Hello everyone, thank you for joining us once again. Welcome back to our web series. My name is Michael. I am a speech-language pathologist and I work with Providence Home Health and Hospice right here in Wichita, Kansas. I love being with a local company. I feel like we've got a pretty good grip on the community and how we can help them. And today we're going to talk a little bit about fall prevention. Before we do, I always like to talk a little bit about home health. Home health is a benefit that is paid out generally at 100% by your insurance, meaning there's no out-of-pocket cost. In order to qualify, the guidelines state that it's a taxing effort for you to do things such as shower, dress, and when you go out and come back home, was it a taxing effort? Are you tired? Does it take you a while to get back onto your feet and start to do the things that you enjoy again? If that's the case, home health may be what you need to help you get back onto your feet. But speaking of on our feet, one of our biggest goals in home health is to keep people out of the hospital. And falls are one of the biggest reasons individuals over the age of 65 are hospitalized. So I want to start out first by talking about some indicators, some things that you want to look for in yourself, in your loved ones, in your friends and family. Indicators that you might be at risk to be a fall. The first one would be a fear of falling. And fear actually can increase our risk of falling because we stop doing a lot of the things that we once did. We become more sedentary, therefore we lose more muscle. Other indicators, poor balance. When you go from sitting to standing, does it take you a couple of times to get up? And when you do you feel unsteady? We call these the wall walkers. You've all seen the people that have to have their hands on a wall or a piece of furniture as they walk. That's an absolute indicator that they're at risk for a fall. Difficulty or instability when turning. We see a lot of this, especially with individuals that use durable medical equipment such as canes and walkers. While I'm on that topic, I do want to say that if your physician has recommended that you get a walker, please make sure that you ask he or she if home health should be included, because that is a durable medical equipment and you should have some training in order to use it properly. Other indicators are short shuffling steps. We see this a lot with Parkinson's, a lot of neurological deficits. The use of an assistive device, such as a walker or a cane, actually puts people at risk if they don't have the correct timing. Does it require you more than one attempt to rise? If it takes you several times to get up out of your chair, maybe you need a little bit of assistance in doing so. The last thing we want is for you to stand up and go right back down. Do you take 4 or more medications? Do you ever get dizzy or vertigo? Have you stood up too quickly and felt dizzy? All of us have at some point in our life, but if that's happening to you on a pretty regular basis, you are absolutely at risk for a fall, and we'd love to talk to you to let you know what we can do to help you out. Did you know that the highest percentage of falls happen in the morning and in the evenings? There's several reasons for this. The first being poor lighting. Generally speaking, when we get up in the morning or at night, especially when we need to use the restroom, we don't have the best lighting. Maybe we're having a medication reaction. Most of us take our medications in the morning or in the evenings, and that's when we're going to see a reaction. The sleep to wake stage. I don't know about you, but when I wake up, it takes me a few minutes to gather myself so that I can actually get out of bed. And then rising from bed too quickly. And this goes back to that blood pressure dropping when we stand up too quickly. If that's happening often, please contact us as soon as possible. So 85% of falls occur in the home and 44% of those are due to environmental hazards. Our therapists will come out and may make recommendations on how you could move your furniture. We may make a recommendation for you to move a rug. And oftentimes people don't like that. We want to make sure that you know that what we do is make recommendations. We will never come into your home and tell you exactly what you have to do, just what you should do so that you can remain safe. What do you do if you do have a fall? The first thing is to make sure you remain calm. Movement can actually make injuries worse. So the best thing to do is to move around very softly and gently to see if you've got any injuries. If you do, you should call 911 immediately. I recommend to all of my patients over the age of 65 that they look into an emergency response system, one of those handy buttons that you can click in case you do have a fall. I have people tell me all the time, well, I have a cell phone. And unfortunately, when you get up and use the restroom at 2:30 in the morning, most of us don't take our cell phones with us. However, that is when a large percentage of falls happen. So to have one of those buttons can really be a lifesaver. So there are some myths that I want to talk about very shortly. These are things that I've heard as I've been out in our community. The first one is when you are older, you need to expect to hurt. And it's inevitable that you will fall every now and then. The next one is there's really nothing you can do about it. Unfortunately, we have heard this not only from patients, but also from physicians. And we would like to educate those physicians when we have the opportunity and let them know what physical therapy, occupational therapy, and speech therapy can do for those individuals. Here are the facts. The facts are that the aging body responds very well to a muscle strengthening regimen. What we see is when individuals get onto a home exercise plan and really dig into it, we can see progress in days and not months and not years. Very quick progress is seen. Other facts, the best exercise programs for the elderly are those designated specifically for each patient. And we are very big on not doing the cookie cutter approach. You're an individual and we want to treat you like you are. We want to develop an exercise plan that works for you, for your schedule, but also doesn't outdo it or overdo it. As we age, we must accept that physical exercise is no longer an option. It's a necessity if we want to remain functional. And exercise is proven to extend life expectancy and to improve mental alertness. So what can Providence Home Health do? Well, we want to help you successfully and gracefully age in place, remain functional. One of our biggest goals is to help individuals maintain their dignity. We want to help avoid unnecessary hospitalizations and nursing home placement and preserve insurance resources and benefits. Folks, we are very, very up to date on fraudulent therapy, and we want to make sure that number one, you qualify for home health, and number two, that it's something that you will benefit from. So that's something we're going to do during our opens, which is when we admit you as a patient. So if you are at risk for a fall, the first thing we'd like you to do is speak with your physician. Let them know that you're having some fear or that you're unsteady. Maybe your balance isn't what it once was. If you are in a community such as an assisted or an independent living, let the nurses there know that you're having some difficulty. And we definitely want you to speak with family. Family needs to know that you're having some hard times because oftentimes they will want to get involved to help. So if you have any of those indications, if you're feeling any of those dizzy spells that we talked about, if you're feeling unsteady on your feet, please reach out to us here on our Facebook page or give us a call at 316-558-5956, and together we can help everyone stay on their feet and enjoy a happy, healthy life. Thank you so much for your time and have a great day.